Hi everyone. Let us today talk about the short topic of electrocochleography. This is it was confusing. It's confusing. So let us just talk a little bit in detail, but it's a short topic. So what do we basically do? It's an objective test and we record the electrical activity of the cochlea and the auditory nerve. So here we are taking an recording probe and we are recording apparatus and we are passing an electrode through the tympanic membrane. We are placing it on the cochlea. Okay, so what is it doing? It is able to record the electrical activity of the hair cells, that is called the cochlea. Three parameters are recorded: cochlear microphonics, where it is measuring or it is recording the electrical activity of the hair cells. So whatever hair cells are hair cells activity, the little bit of movement of the hair cells move, right, a little bit. There is a little bit of vibration all the time of the hair cells, and that is recorded by this electrode, and that we call the cochlear microphonics. And then we measure what is called the summating potential, the electrical activity of all the hair cells of the cochlea. All the hair cells of the cochlea, if we measure together, we call it the summating potential. Yeah, it is a summating potential. So in the word only, we have the sum of all the electrical activity of the cochlea. Whatever the electrical activity of all the hair cells and other things that a cochlea can basically generate, you are putting it in summating potential. Summating, it is able to pick it up. That is called summating potential. It is also able to record what is called action potential of the distal part. It is able to measure the activity of the distal part of the auditory nerve. Suppose this is the auditory nerve, this is the distal part. Distal part is what, where it is attached to the cochlea, and what is the proximal part, where it is attached to the brainstem. Okay, where it is attached to the brainstem. So it is able to record the electrical activity of the distal part of the auditory nerve. Okay, so we are getting three things by putting an electrode. We are getting a cochlear microphonics, that is nothing but the electrical activity of the hair cells of the cochlea. Then we have the summating potential, SP, that is the sum of all the activity of the hair cells of the cochlea. Whatever the electrical activity that the cochlea is generating, entire thing is called summating potential. Action potential, always this is used only with a nerve, right? That is what we learn in physiology. Action potential is a nerve only. So but which part of the nerve? The distal part, from where it is just leaving the cochlea, it is going towards the brainstem. The distal part, it is measuring the action potential. Now what is the use of measuring this? Always remember, action potential is always bigger than the summating potential. Action potential is always bigger than summating potential. You can remember it like this. For an action potential to travel all throughout the nerve, it has to be obviously of a higher intensity compared to the whatever is generated in the cochlea. This is how you can remember. Okay, so action potential is always larger, because summating potential is like, okay, all the electrical activity of the cochlea, it doesn't have to travel, it doesn't need that much of energy. But an action potential has to travel all throughout the auditory nerve. So the action potential, always the length of the amplitude of the action potential is always higher than the summating potential. Actually, summating potential is always 1/3. So summating potential, if it is 0.3, it is normal. Okay, this is in the right ear, it's a normal ear, and action potential is 1 microvolts. Summating potential by action potential is 30%. So you give a stimulus and then you see what happens to the summating potential. Summating potential is coming at 0.3 microvolts and action potential is coming at 1 microvolts. So the summating potential by action potential is 30%. So as long as it is 30%, it is normal. Once it starts crossing 30%, that is like 40%, it is definitely abnormal. 60% here in this example, it is definitely abnormal. So here we have given a stimulus and the summating potential has come up to almost 60% of the action potential. It has come to 60 microvolts, sorry, 0.6 microvolts. Summating potential has come to 0.6 microvolts and action potential has come to 1 microvolts. So summating potential by action potential is 0.6 divided by 1, that is 60%. So it has increased above 30%. So then that means that this patient is having cochlear type of hearing loss. cochlear disease is there. So the summating potential has increased. In diseases of the cochlea, summating potential is increased. In diseases of the cochlea, we expect that the cochlea is not working well, so the electrical activity of the cochlea should go down, but that's not the case. Okay, this is the opposite. In disease of the cochlea, the summating potential, the sum of all the action potential, electrical activity of the cochlea, summating potential of the cochlea is increased, almost doubled. Here in this case it is almost doubled. From zero point 0.3 it has doubled to 0.6. So when it has doubled to 0.6, then the ratio will also change. So we remember it like 30% summating potential by action potential ratio is normal. Anything above is considered disease of the cochlea. For example, Meniere's disease. So this electrocochleography is especially used to diagnose Meniere's disease. In Meniere's disease, if we have a doubt, we do a electrocochleography, and if the summating potential by action potential ratio is greater than 30%, we diagnose it as Meniere's disease. So it's diagnostic of Meniere's disease. Thank you.